Hi, I'm Dr. Tessa Scripps. I'm an assistant professor of pediatrics at Mount Sinai, and I'm a general pediatrician at the Faculty Practice Associates. So, norovirus is a common contagious virus that inflames the intestines and makes people feel nauseated, have diarrhea, and throw up. Sometimes it can actually cause stomach pain and fever as well. Well, norovirus is highly transmissible, and infected people can actually shed billions of norovirus particles at a time, but it can take fewer than 100 norovirus particles to make another person sick. People are most contagious when they actively have symptoms and in the few days after their symptoms have resolved. So it's a good idea to keep some distance from people who are actively sick or who have just recently recovered from being sick with norovirus. The most common way norovirus is spread is through close contact with an infected person. Norovirus can actually get a whole family sick at the same time because family members ingest tiny, unnoticeable particles that are shed through diarrhea and vomit. So, the most important thing that you can do to prevent transmission is to wash your hands frequently with soap and warm water, particularly if you've been in contact with a person who has symptoms of vomiting and diarrhea. It's important also to know that alcohol-based sanitizers like Purell do not work as effectively against preventing transmission. So make sure you lather your hands up with soap and warm water during this norovirus season. So while norovirus is extremely contagious, the majority of times it only causes a few days of mild symptoms. It's most important to drink plenty of fluids if you get sick with norovirus, as excessive vomiting and diarrhea can lead to dehydration. The best way to stay hydrated is to drink small volumes of fluids, maybe 1 to 2 ounces every 1 to 2 hours, so as in to ensure that fluids get absorbed and to prevent recurrent vomiting. Drinking water and electrolyte fluids like Pedialyte, Gatorade, or watered down apple juice can be very useful to maintain hydration, and also can help prevent complications from norovirus. For newborns, you can offer them small volumes of breast milk or formula, and this can also be very useful for ensuring adequate hydration. Newborn babies and children who have underlying chronic illnesses like kidney disease, diabetes, and metabolic diseases are at higher risk for becoming dehydrated and severely ill because excessive fluid losses can affect their kidney and their liver function. It's important for these higher risk patients to seek medical attention right away if symptoms last longer than 3 days or if they are unable to keep hydrated. So it's important to watch for symptoms of dehydration if your child gets sick with norovirus. Signs of dehydration include decreased or less frequent urination and small volume or very concentrated appearing urine. If you notice that it's been over 8 hours from when your child has had a wet diaper or used the toilet to pee, you may want to reach out to a medical provider for advice. A rapid heart rate or a significant change in your child's activity can also be a sign of dehydration. If you notice that your child seems very lethargic and listless, you will want to seek medical advice right away. The best way you can support your child who's been infected with norovirus is to ensure adequate hydration and rest. Once the virus has passed through and the vomiting and diarrhea has subsided, it's okay to offer bland foods like rice, dry cereal, applesauce, bananas, and crackers. To prevent the spread of norovirus, it's really important to wash your hands with warm water and soap. You should also wipe down any contaminated surfaces with a bleach-based disinfectant. You should also avoid sharing food and drinking cups with sick people. And finally, you should just try to maintain some distance from infected household members while they're actively sick. Sometimes it's difficult to tell the difference between norovirus infection versus food poisoning versus other types of stomach infections. In the majority of cases, testing for norovirus is not indicated because symptom management is the same for all manner of stomach bugs, and so it's not a very useful test to run.